Does chemotherapy have side effects?
Yes, it attacks not only fast-growing cancer cells, but also normal cells that grow at a similar rate. As some of the healthy cells are destroyed, the body can respond in a negative way with side effects. Not everybody has the same degree or type of side effect. They vary with the type and strength of the drug used and the person's reaction to it.
What are the most common side effects?
1. Loss of hair. Chemotherapy doesn't always cause hair loss and is dependent on the type of drug used. Remember that even if there is a total hair loss, it will be temporary. Hair will grow back once the treatment is stopped. You may also lose your eyelashes, eyebrows, chest hair, underarm hair, leg hair, and pubic hair. Losing your hair may not be easy to accept and may take some emotional adjustment. If you have long hair, consider cutting it short before treatment starts. This allows you time to adjust. Wigs and scarves can be used if you're feeling self-conscious. When your hair does grow back, it may be a different texture and/or color. 2. Emotional state. Changes in your emotional state can cause problems in relationships and in the ability to cope. These are discussed in depth on track 2. 3. Low red blood cell count, known as anemia. This can cause tiredness, dizziness, and shortness of breath. You may want to try these ideas to conserve your energy. Take rests often. Let friends and family help. Plan your day to avoid too much physical work. Eat correctly. When you wake up, don't get up too quickly. 4. Low white blood cell count. This increases your risk of developing an infection. During treatment, it's advisable to avoid people who are ill, as your body cannot fight infection effectively. Even if you are careful, you may develop an infection. Should you have a fever, cold shivers, sweating, coughing, or a sore throat, please report to your doctor before taking any medication. Before each treatment, your white cell count will be checked. If your count is too low, your chemotherapy treatment may be postponed until it rises again. 5. Low platelet count. You bruise or bleed more easily, so avoid any activity that could cause injury. Take special care when working with sharp tools or knives. 6. Nausea and vomiting. In most cases, this is treatable, thanks to new drugs. 7. Pain as a result of the cancer or treatment can interfere with normal activities. Treating it helps you feel stronger and better able to cope. Ask your doctor for medicine to relieve pain. Take your medication at the prescribed intervals and don't wait for the pain to become intense. 8. Tender and sore muscles, as well as a burning sensation of pins and needles in the hands and feet. Take precautions to prevent injuries and avoid handling hot items at this time. 9. Weight gain. This can happen not only from overeating, but as a result of certain medication, as well as decreased activity. Some medications cause the body to retain too much fluid, resulting in swollen hands, feet, face, and abdomen. This is called edema. 10. Temporary or permanent sterility. If you're concerned about the possibility of becoming pregnant or fathering a child, please discuss this with your medical team. 11. Other side effects such as loss of appetite, weight loss, sores in the mouth, taste changes, sensitivity to heat and cold, diarrhea, or constipation are discussed on track 3. Chemotherapy can cause other side effects, many of which are temporary. They can vary from treatment to treatment. Discuss them with your medical team. Most of the side effects will gradually disappear once treatment is stopped and the healthy cells have had a chance to grow normally. Do not reject chemotherapy based on the experiences of friends or family, as each person reacts differently. Although the side effects of the treatment may be unpleasant, measure this against the medicine's ability to destroy the cancer.
Can I breastfeed while on chemotherapy?
No, the drugs will be transmitted to your child through the milk.
Can I take other medicines while I'm having chemotherapy?
Certain medicines may lessen the effectiveness of your cancer therapy. Before beginning treatment, give your doctor a list of all the medications that you're taking, including laxatives, flu medication, painkillers, contraception, and vitamins.
What about alternative forms of treatment whilst undergoing chemotherapy?
Before using any other medication or therapy, it's important to talk to your doctor to ensure that this will not lessen the effects of any treatment that you are currently undergoing. Relaxation, massage, visualization, hypnosis, and biofeedback can be beneficial, as they are able to reduce and control pain. They can also decrease anxiety and help you to sleep.
Why should I go for treatment?
The main aim of treatment in many cases is to cure the patient. Sometimes, though, a cure may be unlikely. Then the aim of treatment is to control the disease for as long as possible while preserving quality of life.
How does chemotherapy affect sexual function?
Chemotherapy may affect sexual function and organs in both men and women. It's essential to discuss these issues with your doctor. Fear can affect personal and sexual relationships. Your fears need to be discussed openly with your partner to understand what each of you is feeling. These fears may include rejection, loss of libido, changes in attractiveness, and sterility. While it may be possible to become pregnant during treatment, it's not advisable, as some of the drugs can cause birth defects.
How can these treatments affect my daily life?
Though there may be unpleasant side effects, many people manage to lead as normal a life as possible while having treatment. We encourage you to do this. There is no reason to stop going out or visiting friends. However, as avoiding infection is important while on chemotherapy, avoid close contact with people who are ill. If you're unable to go out, accept it, be gentle with yourself, and rest as much as you need to.
How will I feel during treatment?
The greatest fear of all is the fear of the unknown. It's important to get knowledge about your condition. If you feel worried or discouraged, talking openly and meaningfully about your fears and anxieties can help you overcome these feelings. This is a difficult time, and if you're unable to cope on your own, it's not a sign of failure. Once people understand how you are feeling, they can be more supportive and helpful.
Although cancer is a journey that many people have undertaken, it's not an easy road. Take time to be in touch with your feelings and understand what you are going through. The Cancer Association has many facilities to help you at this time, including counseling, support groups, interim homes, and loan of medical equipment. Please contact them on 0800 22 66 22 for help and information, or refer to the enclosed booklet. This information is also available on their website, www.cansa.org.za. We wish you strength on your journey.